Hey y'all, it's Julie the Nursing Tutor. We're going to talk about SIADH and Diabetes Insipidus. Don't get this confused with diabetes mellitus or mellitus, however you say it. The only reason they named it diabetes is because they have polyuria and polydipsia. But anyway, diabetes insipidus, they need a sip. Okay, I'm going to tell you about 40 times before it's over. Okay, but I want to make sure that you know this. So, put your foot on the floor. I'm going to make you dizzy. So, these two, SIADH and diabetes insipidus, are you all right? Dude. Probably need a CT of your head after that, but my bad. So, these two disorders are dealing with antidiuretic hormone. It is released by the posterior pituitary. However, it is simply stored there. It's made by the hypothalamus. It produces it. Hypothal, you'll know. And the cool thing about the posterior pituitary is it's got two hormones, and that starts with two P's, and their hormones start with vowels. ADH and oxytocin. Oxytocin. Okay. There are two things that tell the kidneys when to conserve water. Antidiuretic hormone is one of them. Diuretics make you pee. Antidiuretics make you not pee. I have to say that every single time I'm thinking about it. And then aldosterone tells the kidneys to save salt, and water follows. Antidiuretic hormone don't have an S in it. So it has nothing to do with sodium. It just simply tells the kidneys to save water. Okay? H2O. All right. So here we go. Let's talk about these two. Oh, hold your head up. Now you probably got a cervical spine injury. You whack-a-dude your head. All right, here we go. Or I did it. But I'm not stopping. Look at Soggy Sid. Soggy Sid. He's soggy. So here's his story. Look at him. God love him. And look, he's dripping, my God. And he's got a baseball hat on with a Band-Aid on it. I don't know if that's the trend, but, you know, here we go. Soggy Sid has SIADH, syndrome of inappropriate antidiuretic hormone. What is inappropriate about it? He's got too much. Because diuretics make you pee, antidiuretic make you not pee, and he's soggy. Hopefully that just hit the bell with some of you. With increased ADH, the body retains water and gets so soggy that water intoxication may occur. Sid's cap is hiding his bandaged head from a head injury, which is a risk factor for SIADH. I have seen that in NCLEX questions before. A patient came in, they been in a wreck or something and had a head injury. You, using your nursing knowledge, know that they're at risk for SIADH. That's frontal lobe material right there. Okay, due to the cerebral edema, he's prone to seizures. Who is? People with SIADH. So we'll have to fling some precautions on them, seizure precautions. Notice that his limbs are small. There's no obvious edema, yet he's gaining weight in his body. The intake and output record will document low urinary output because he's keeping it all on board. But the urine-specific gravity will be high. I mean, what little bit he is peeing is thick. The specific gravity is high. The serum, this is in the blood. When you see serum, they're talking about in the blood. The serum sodium will be decreased because it's diluted. because he's got all the water on there. But he's still going to have the problems of hyponatremia. And those are usually in your head. You know, you're irritable or lethargic. Or anyway, we'll talk about that on another video. Limit soggy SIDS fluid intake. He may be given diuretics to help with fluid excretion, especially if he has respiratory or cardiac problems. Father God. Keep soggy SIDS bed flat or only slightly elevated. This position will decrease the secretion of ADH. How cool is that? Lay down. All right. Keep the neurochecks going. Soggy SID is in serious condition. And if we had read about hyponatremia, we would see a link. But that's going to be on another video. Soggy SID. And then, diabetes insipidus. We got this dried Californian prune. Diabetes insipidus needs a sip. You hear me? I believe you hear me. All right. So let's read this story. And I want to point out some things. Due to the lack of putrescin. That's another name for ADH. Okay? That's man-made. Well, it may be the smoking dope name. You know, they always have a regular name and then something that sounds like people were high when they came up with it. But anyway, putrescin is another name for ADH. So due to the lack of putrescin excretion from the pituitary gland, our poor dried California prune is shriveled up because he urinates a lot. Polyuria. The loss of body fluids will cause him to become very dehydrated and have a low specific gravity because he's peeing buckets and oodles and gobs. And so the specific gravity is going to look, you know, diluted. Like his specific gravity will be low because it's so dad blame much water. He may require IV fluids for rehydration. This guy can get dehydrated in a hurry and must be watched quickly. If we had talked about hyponatremia, we would have done it. But I'm going to sing you a song. You can sing it with me. It's Dookie Fort. Sorry. Sung to the tune of bingo. So, SIADH, SIADH, SIADH. The hormone stops a PP. Brain tumors, traumas, and bad bugs. A complication might be SIADH, SIADH, SIADH. The hormone stops the PP. I'm going to bring it up. Low output, sodium gained weight, and high specific gravity. SIADH, SIADH, SIADH. This hormone stops the PP. But diabetes insipidus, the opposite, you'll see. PP, give IVs. PP, give IVs. PP, give IVs. Vasopressin. That's another name for ADH they will need. High output sodium pounds lost in low specific gravity. PP, give IVs. PP, give IVs. PP, give IVs. Vasopressin they don't need. Okay. I hope you enjoyed it. Look, find me on YouTube, please. Every single person, please subscribe. Let's get the subscribers up over there. And if you can't find me on YouTube, some people have said, I can't find you. Some people have said, no problem. But this is my Facebook page. All my YouTube videos, which are the same as TikTok, are on Facebook. So you can click the link and then subscribe to my channel. Okay? I hope this helped y'all. Y'all have a good evening.